If you're dealing with peripheral neuropathy, you know the drill, the burning, the tingling, the numbness that keeps you up at night, the struggle to walk without feeling like you're stepping on pins and needles or that your sock is rolled up under the ball of your foot. Maybe you've tried medications that left you feeling foggy or barely touched the pain. Here's the good news. Peripheral neuropathy treatment has come a long way, and not all clinics are created equal. At Aniana Spine and Laser, we're doing things differently, combining cutting edge technology with old school personalized care. Before you book your first visit, here are 5 things you should know about how we approach peripheral neuropathy treatment. Number one, we use advanced class 4 robotic laser technology. This is not your average laser. Let's talk tech for just a second. You've probably heard about laser therapy, but what we're using here in Aniana is next level stuff. The class 4 MLS M6 robotic laser. This isn't some handheld device that requires a technician to manually move it around. The M6 is a robotic system that delivers precise, consistent treatment to the affected areas, usually your feet, your legs, or your hands if you're dealing with neuropathy. Here's why that matters. The class 4 laser penetrates deep into the tissue, reduces inflammation, increases blood flow, and stimulates nerve repair at the cellular level. It's non-invasive, it's drug-free, FDA approved. Patients consistently report less pain, better sleep, improved ability to walk after just a few sessions. So during your first visit, I will explain exactly how the laser works for your specific case. You'll wear protective eyewear, get comfortable on the treatment table, and let the technology do its thing, usually about 20 minutes. Most patients describe it as a warm, soothing sensation. There is no downtime, just targeted precise healing. Number two, it's not about masking pain. We address the root cause. And here's where a lot of traditional medical approaches really do fall short. They focus on symptomatic management or symptom management rather than getting to the bottom of why you have neuropathy in the first place. Sure, medications like gabapentin might take the edge off of the pain, but they're not addressing the root cause or the underlying problem. And they often come with side effects like dizziness, brain fog, weight gain that can make you feel worse in other ways. So at your first visit, I'm going to take a different approach. I'm not going to just ask about your symptoms. I'm going to dig into your health history, your lifestyle, medications, and even your nutritional status. You might ask why? Well, peripheral neuropathy has many potential causes diabetes, but also poor blood sugar regulation, B12 or other nutritional deficiencies, medication side effects, autoimmune conditions, even spinal issues can cause nerve root compression. We use a functional medicine approach to identify and treat the root cause whenever possible. That might mean working with you on blood sugar management, recommending specific supplements to address deficiencies, or combining laser treatment with other advanced modalities to relieve nerve pressure. The goal isn't just to help you feel better temporarily, it's actually to improve your nerve function and halt the progression of neuropathy. Number three, you get one on one time with me. Let's be honest, when was the last time you saw a doctor who actually listened to you for more than 5 minutes at a time and then had to rush off to the next patient? At Aniana Spine and Laser, your first visit isn't a conveyor belt experience. I will spend time with you. I'll get to know your story, your struggle, and your goals. This matters more than you might think because peripheral neuropathy affects everyone a little bit different. One person might struggle most with sleep disruption from burning feet. Another might be terrified of falling because they can't feel their feet properly. Someone else might be most concerned about losing their independence. I will take the time it takes to understand what matters most to you, then build a personal treatment plan around those priorities. Number four, treatment is Personalized using functional medicine. Now, this does tie back into point two, but it deserves its own section because it's such a game changer. Functional medicine looks at the body as an interconnected system rather than a collection of separate parts. When you have peripheral neuropathy, you don't just treat your feet, we look at your whole health picture because treating neuropathy effectively means addressing the metabolic and nutritional factors that contribute to nerve damage. Your personalized treatment plan might include the Class 4 robotic laser session, specific nutritional supplements, dietary recommendations to stabilize blood sugar, lifestyle modifications, and other modalities if they appear to be necessary. This comprehensive approach is what sets functional medicine apart from the take the pill and call me in 6 months model. Now, number five, small town care gets better results. There's something to be said for getting treatment in a community where your doctor knows your name and actually cares about your outcome. You wouldn't believe my patients are always on my mind. In big city clinics or corporate healthcare settings, you're often just another number. Treatment protocols are one size fits all, follow up is minimal. Here in Aniana, which is Blount County, we do things differently. I actually built the practice on relationship and results. When you're part of our patient family, your progress really, really matters to me personally. So that means accountability, flexibility, accessibility, and community. When you're surrounded by neighbors who've experienced similar health challenges and found relief, studies consistently show that patient outcomes improve when there's a strong doctor patient relationship and continuity of care. That's harder to achieve in a high volume, in-personal setting. Small town care isn't just more comfortable, it's often more effective. So, what to expect moving forward? If you're ready to take the next step, here's how it works. Call us at our office number. It's on this page somewhere, 205-625-3488. Schedule your first appointment. Fill out the new patient paperwork. You can do this online or in our facility. When you come in, we will scan your feet looking for structural abnormalities. We'll do a neurological exam to determine the severity of your neuropathy, and then we will do a full-blown treatment. Then I will review the findings and make recommendations for future care. I want you to start feeling better. Most patients do notice improvement within the first few weeks. Peripheral neuropathy doesn't have to control your life. With the right technology, the right approach, and a doctor who actually cares about getting you better, you can reduce pain, improve sleep, walk with more confidence, and get back to doing the things that you love.